For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Today we have 2 physicians here to discuss population health and how to keep our community healthy. Our first guest is Dr. Michael Hill, the Medical Director of the St. Tammany Quality Network. Welcome, Dr. Hill.
Hi.
Can you first tell us a little bit about your background and what you do at the hospital?
Right. I'm an infectious disease physician at the hospital. I've been at the hospital on staff for 13 years, and I'm also medical director for St. Tammany Quality Network.
Okay, and I guess first, can you tell us what is St. Tammany Quality Network?
Well, it is a group of physicians that is supported by the hospital that deal with population health issues and improving the health care of our community. We have 254 physicians that are on our hospital staff that belong to the network. They're all specialties, primary care, as well as medical and surgical specialties in the hospital.
Okay. And are they all, but they're not all employed by the hospital?
No, many of them, and as a matter of fact, most of them are community physicians.
Okay, that are just closely aligned with St. Tammany?
Correct, yes, they're closely aligned. Many of them have been on the staff even longer than I have. They're committed to making sure the hospital provides the best care, which I think we do in the community, and certainly outpatient care as well.
Okay. So you mentioned population health. Can you kind of explain what that is?
Sure. Well, you know, as a physician, I was always interested to take care of the individual patient. But as I started taking care of patients, I started thinking about how it would be nice to be able to take care of groups of patients with similar conditions and improve the health care of not just that particular patient, but of the community. And so what population health does is exactly that. It works on preventive care, trying to work the patient up to take care of all the chronic conditions they may have and make them the healthiest they possibly can be. We want to attempt to make sure that all of our residents in Western St. Tammany have a healthy lifestyle, that can live their life to the fullest, and we want to keep them out of the hospital and do a lot of preventive care, which is much less expensive than having to treat acute care.
Okay. And I assume a lot of this starts with primary care, so I guess that is important for patients.
Yes. We stress that we want all of our patients in the quality network to have a primary care physician. And the primary care physician really is the quarterback. You look at this as a team. Many patients have many different issues, and sometimes patients just go from specialist to specialist. And certainly the specialists provide important care, but they're not always talking to each other. So I think it's important that we have the primary care physician be able to aggregate all of the information with regards to the patient and assist in deciding what's best for that patient's health.
Okay. And so do you recommend that if a patient thinks they need to see a specialist, they start with their primary care doctor always?
Yes. In most cases, I would say go to your primary care physician first, because many things that you think you may have to go to a specialist for can be handled on a primary care level. And the primary care physicians can decide at that point whether or not you need to be referred to a specialist. Certainly in emergent situations, or for example, if you have a cardiologist and you're having heart issues, certainly you can go right to the cardiologist. We're not saying stop by the primary care doctor first, but if you don't know, if you just have symptoms and you want somebody to check that out, we're asking, please go to the primary care physician first. And we're also asking everyone, even if they're feeling healthy, to make sure that they have a yearly visit with their primary care physician to assess any needs that they may have with chronic health conditions, such as hypertension or diabetes.
Okay, and most insurances cover like a once-a-year primary care visit, don't they?
Yes, they do. It's called a wellness visit, and most insurances cover that completely.
Okay. So I guess, how can patients become more involved in maintaining their health?
Well, I think that that's where the primary care physician comes in, and certainly the role of the physician or healthcare provider that you go to is a little bit different than it used to be. We're actually helping patients take charge of their health care, because so much of health care is outside of the hospital or the doctor's office, and it's a lifestyle change. It has to do with what you eat, when you exercise, reducing stress, making sure that you have good social connections, and trying to get people connected maybe with common diseases so that they can talk about the issues that they're facing. And also not just the patient, but bringing in the family support and the community support as well. And I think we do a really good job at that at St. Tammany Hospital.
Okay. So what are some major health conditions that affect our community?
Well, as I said, hypertension is probably the biggest one and the underlying driver with many health conditions. And uncontrolled hypertension over time certainly can lead to a lot of side effects.
First, can you explain what hypertension is for those?
High blood pressure.
Okay, that's more layman's terms.
It's important that people with hypertension have their blood pressure checked on a regular basis, have their medications adjusted as needed. We have several very good medicines that we didn't have just 15 or 20 years ago that have less side effects and are more effective. Diabetes is another one. In our community, many of the patients, and about 20% of our admissions are linked to diabetes. So it's really important that both for patients with type 1, which is adult onset diabetes, type 1, which is juvenile diabetes, and type 2 diabetes, which is adult onset diabetes, be treated. And most primary care physicians can treat all of the diabetic needs. If you have a complex case, and certainly you may go to an endocrinologist. The other one is coronary artery disease, and certainly hypertension and diabetes are cofactors with coronary artery disease and peripheral vascular disease in our community. So those are the main ones that we look at. The other area that we certainly are focusing on is obesity, which I think is playing a bigger role in our society. And makes hypertension worse, diabetes worse, and certainly we're working on getting patients to eat properly, weight reduction, to reduce the effects of those other comorbid conditions that we spoke about. And certainly we'd rather have people lose weight and have a blood pressure control with reduction of salt intake and weight loss, rather than keeping them on a lot of medications.
Right. Okay, and I know something we've talked with you about in the past is antibiotic stewardship. Does that play into population health?
Certainly, and particularly in the outpatient setting, many patients go to the doctor with what they perceive is a bacterial infection, when in fact it's a virus, and antibiotics don't treat viral infections. 80% of the respiratory infections that we get are viral infections, and they're self-limited. They'll go away on their own. The fact is, the overuse of antibiotics has led to antibiotic resistance, and we're trying to reduce the exposure of the bacteria in our community to antibiotics, so we reduce the antibiotic resistance in the community. If we don't do this, at some point we'll run out of antibiotics. So it's important to use antibiotics judiciously. We do the same thing in the hospital. We try to limit the amount of antibiotic exposure and the duration of antibiotics for patients who come in that need antibiotics.
Okay. And something I know we wanted to talk about was the flu. Is that something we can use antibiotics for?
No, the flu is, and we had a horrible flu season last year, probably the worst we've had since 2010.
Oh, wow.
And I think it's important, although the flu vaccine isn't always completely effective, we are recommending that people get flu vaccines. Usually the best time to do that is in late September through early November. We'll have the vaccines available, at that time in the physician's offices. Even if it doesn't protect you completely from the flu, it can reduce the symptoms when you do get the flu.
Okay, and I know a lot of people get nervous about it because they feel like it's something that's different every year. Is there any reason that somebody shouldn't get the flu vaccine?
There are occasional people who have severe reactions to the flu vaccine. It used to be because it was produced with egg and some of the preservatives. We now at St. Tammany use primarily preservative-free vaccine. The egg allergy situation is much better, so only people with really severe allergies are excluded. I would say the majority of people can safely get a flu vaccine, and it can't give you the flu. It sometimes will make you have a runny nose or have some symptoms because it does rev up your immune system, and that's part of the reason that it's important to get the flu vaccine, because your immune system is then ready to take care of the flu if you get exposed to it.
Okay. And so all of these things we kind of talk about, it's all about keeping the community healthy and out of the hospital, right?
Right. Although we're St. Tammany Hospital, we're really St. Tammany Healthcare. The community, we want to take care of our community. And certainly the hospital's there when you're very sick.
Right.
And that's who we want to treat. And we want to keep the people who don't need to come to the hospital in other settings. And preventive care is certainly the most efficient and care out there, and keeping people outside the hospital gives them a better lifestyle.
Awesome. Well, thank you so much for being here. I appreciate it. I'd like to thank Dr. Hill for being here and giving us that great information about population health. Up next, we have Dr. Christopher Foray here to give us a little more details about population health and how we're keeping our community healthy.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Oxnard, collaborating in the name of community.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Dr. Christopher Foray, a primary care physician at our STPN Folsom office. Welcome, Dr. Foray.
Thank you, Amanda.
Can you first tell us a little bit about your background and what you do?
Sure. I was born and reared in Washington Parish. I graduated from LSU undergrad in 1990, LSU Med School in 1994. I did my training in South Carolina at the University of South Carolina in Columbia. I'm board certified in family medicine. Additionally, I'm president of the Louisiana Academy of Family Physicians and vice chairman of the Louisiana Patient Compensation Fund Oversight Committee, among other things.
Okay. And so I mentioned that you're a primary care. Can you talk a little bit about that and how long you've been doing that?
Sure. I've been in practice for 20 years. I've been employed with St. Tammany for almost 15 now. The first 12 years were in Franklinton. The last, close to 3 years now, I've been in Folsom.
Okay. And so what does a family physician do?
Everything, in a way. Take care of people of all ages, from newborns to geriatric patients, some procedures, some hospital work in the past, which I did, but no longer, but primarily ambulatory-based in clinics.
Okay. And what is your perspective in reference to population health? I know Dr. Hill kind of explained what it is, but...
Population health will be a valuable tool for the primary care physician and the family physician particularly. Population health can take our population literally from being the unhealthy population, not just in Louisiana, but the United States, to the pursuit of a healthier living with a better quality of living.
Okay. And how can it impact your practice? And you talked newborn to geriatric. Can it impact every generation,
Absolutely.
every age?
Sure. Newborns, by getting immunizations in a timely manner, can help prevent potentially fatal diseases, or at least diseases that can make children very ill. The geriatric patient, from pneumonia vaccines to shingles vaccines to keeping up with pertussis and tetanus vaccines. As I tell people at times, the goal is to keep you out of the office. And by doing these little steps, it goes a long way in achieving that goal.
Okay. I know he mentioned, we talked a little bit about wellness visits earlier, and that's kind of, I joke, like that's the only time you really want to have to see patients, right?
Absolutely.
Yearly wellness visits. And
Ideally.
Ideally, yeah. So, okay. So we talked a little bit earlier about STQN and the quality network. What are some of the challenges that the network as a whole faces with implementation of population health and improving the health of our community?
I think it's the joy of life we have in the state of Louisiana. We love to eat, we love to drink, we love to just have a good time. Unfortunately, that does not portend a healthy lifestyle. Additionally, with education factors in some parts of our state, not so much St. Tammany Parish, lower education, people with lower education numbers are generally sicker than people who are not. So we have to overcome some of the decades-old problems we have in the state of Louisiana to achieve the places we want to be in population health and the goals we want to be.
Okay. Can you talk a little bit about those? You mentioned in the goals. Can you talk a little bit about those goals? And
Sure. From a diabetes standpoint, the goal would be to have controlled blood sugar to prevent problems like heart attacks and strokes, which are the most common causes of death in diabetics. Additionally, dialysis, renal failure, kidney failure, the primary cause of that is diabetes. One example. High blood pressure can piggyback into that also with strokes, heart attacks, congestive heart failure. These things, specifically congestive heart failure, can lead to rehospitalization, hospitalization for a case and then repeat hospitalizations. The problem with that disease, one of the problems is salt intake. Fried shrimp, fried oysters, what we eat here and how we live. Lack of exercise also complicates all of these diseases.
Okay. And I know you mentioned diabetes, which Dr. Hill also mentioned is kind of something that can cause a myriad of other problems. Isn't that something we can prevent? Sometimes, like type 2 diabetes can sometimes be prevented from even getting it in the first place?
Certainly the onset can. If one parent has diabetes, there's a 20% chance of the patient having diabetes. If two, it's a 40% chance. So we can, if not prevent it, we certainly can prolong the time to diagnosis with a healthy lifestyle. Case in point, I sent a tweet out this weekend. A 16-ounce soft drink, the world's most popular soft drink, has 187 calories. One of those 16-ounce drinks for a month is approximately 5,600 calories. 3,500 calories equal 1 pound. So just by eliminating 16 ounces of the world's most popular soft drink every day, we could lose approximately 1.6 pounds. Over a year, we're staring at approximately 20-pound weight loss just with that step.
Just from eliminating a soft drink.
Yes.
And that doesn't even include, that's not even talking about the sugar and everything else that's in those types of drinks.
Pastas, candies. I tell diabetics in my office quite frequently that in my office, everyone's compliant. No one's smoking, no one's drinking, no one's eating. Unfortunately, you're only in my office for an hour a year. The average visit's 15 minutes. We see a diabetic every 3 months. The rest of the time, you're out there. And there entails the environment with all the enticements that we have in our society.
Okay. You mentioned smoking. Does that play into the kind of population health and the community?
Sure. All of the above. Most people think of cancer when they think of tobacco, and certainly that's a problem with it. However, it complicates diabetes, high blood pressure, heart disease, major risk factor for end organ disease, i.e. vascular disease, with those diseases.
Okay, it kind of, anything you get if you smoke, it makes it a little worse.
I've never seen smoke help anything, cigarette smoke.
All right. So where do you see the population health movement in the next 10 years?
I see it getting some gravity and some momentum. I would hope we're closer to where we need to be in the state of Louisiana in 10 years, but it takes a while to change a culture. As Dr. Hill referred to, these are lifestyle changes. We hear people refer to diet. Well, it's not just diet. It's a lifestyle change. It's trying to take 10,000 steps a day. Right. It's diet, and it's changing a mindset. And I think that with the population health movement, we have great potential to do that. And our state needs it as much as anyone. Okay.
And as most people I think know now, St. Tammany has a strategic partnership with Ochsner. How can that relationship help move this population health movement forward?
The biggest benefit I've seen is with the electronic health record system, EPIC. What that allows is data tracking, whether people have gotten the immunizations they need, have seen the eye doctor, labs that are really within easy access as opposed to thumbing through an old paper chart. That's the biggest thing, and they provided these analytics and they give physicians feedback. They're not necessarily monitoring or stalking a patient, so I wouldn't want anyone to believe that.
Right.
But from a population health aspect, it's certainly a big help.
Okay, yeah, and I know Dr. Hill also mentioned like primary care and keeping everybody in line with what's going on with all the physicians. I think the electronic health record kind of helps with that as well. Everybody can see everything that's happening with the patient.
Communication solves the majority of our problems in our society, and healthcare is no different.
Okay, and I guess how is St. Tammany and the Quality Network working together to improve the health of St. Tammany Parish, but also surrounding parishes such as Washington?
With the Quality Network, there and certain programs and comprehensive joint replacement, trying to limit the number of days in the hospital, try to get people moving faster, trying to use products that are cost effective with the same outcome as the more expensive products.
Okay.
Diabetes education is a huge tool that we're using, and we have a diabetes educator in Folsom 2 days a week, hopefully more in the future. Educating our society, educating our population. The studies have shown when someone goes through diabetes education, a marker that we check every 3 to 6 months is a hemoglobin A1C, which tells us what the average blood sugar is. That number goes down 15 milligrams just by going to class.
Oh, wow. Okay.
So those are things, among others. Mobile screening units that go to different places, breast exams, skin exams. St. Tammany's really on the forefront of trying to improve the community health of all the surrounding parishes in addition to St. Tammany.
Well, and it sounds like a lot of it starts with just education and knowing, rather than just here's some medicine. It's like, let's tell you how to not take the medicine.
It starts at home, and it starts with taking control of the health care. Some of the basic tenets that we've heard when we were growing up.
Exactly. Great. Well, thank you so much for being here and sharing that great information with us.
Thank you, Amanda.
I'd like to thank Dr. Foray and Dr. Hill for being here and kind of giving us some information about population health and how we can keep our community healthy. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.